It's now time to take a look at news stories making headlines around the globe today. Now, the federal government of Nigeria have deployed teams in Cross River and Kogi states to carry out mass testing for COVID-19 cases. The three states have in question thus far been officially declared corona-free, even as confirmed cases across the other states of the Federation continue to rise. Now, overnight, Nigeria's confirmed cases of COVID-19 rose to 381, making that the highest single daily rise that we've had since COVID-19 outbreak began in Nigeria. Our testing laboratories have also increased to 21. Our sister outfit This Day cited figures released by the NCDC and summarized that the new development raised the total confirmed cases to 3,526, with 601 people discharged, 107 people unfortunately dead in 34 states and the Federal Capital Territory. Now, the 381 new cases were reported from 18 states as follows: Lagos, 183, Kano, 55, Jigawa, 44, Zamfara, 19, Borno, 9, Bauchi, 19, Katsina, 11, Kwara, 8, Kaduna, 7, Gombe, 6, Ogun, 5, Sokoto, 4, Oyo, 3, Rivers, 3, Niger, 2, Akwa Ibom, 1, Enugu and Plateau states also 1. Now, this has come as the federal government yesterday said reports at its disposal indicted security agents for aiding the rampant violation of its bans on travels across state boundaries. President Muhammadu Buhari, as part of a series of regulations to slow down the spread of COVID-19, had imposed a nationwide ban on interstate travels, save for the movement of essential goods and services. But as the spread of the pandemic has worsened across states, governors have complained that security agents who were posted to enforce the ban were aiding its violation by unscrupulous citizens. In the meantime, 10 people associated with the Lagos State Government's house at Merida have unfortunately tested positive for COVID-19. In a series of tweets, the State Commissioner for Health, Professor Akin Abayomi, said the development made Lagos State Governor Babajide Sanwo-Olu and his wife to undergo another test for the disease. Abayomi said that the results came back negative. He has appealed to the residents to adhere to the guidelines of regulatory authorities in order to prevent the spread of the disease. So quite a mouthful that we have there, Doctor. 3,526 total confirmed cases now, and we have seen our highest daily rise. Now, a lot of people have panicked over Lagos's figures that we saw, which stood at 183 yesterday. But could this be due to the fact that testing has increased and we've had more access to reagents?
Well, no, with regard to reagents, you know that both the Director General of the NCDC and the governor of Lagos State had pointed out, I think last week, that they need more reagents, that they do not have enough reagents.
Global shortage.
But we don't know what the situation is. Perhaps they've been able to get more reagents. But what is clear is that with 21 laboratories now, it means that capacity in terms of testing has gone up. And according to the Director General of the NCDC, we've done about up to 22,000 tests in terms of what has been done so far. Worldometer says that figure is 22,492. And that's quite, a very wide increase margin when you consider that at a point we were talking about, having tested just about 1,500, and then we'll move to 5,000. And then the number kept increasing.
And it kept going up.
But if you look at it in terms of, per million relative to our population, it's still considerably low. I mean, we're far behind Ghana. We are far behind South Africa, which has been able to test over 4,000 per million and has done over 292,000 tests so far. Now, for Nigeria, it's just 109 per 1 million. So if you look at that test per population or per million, if you use that as the basis, then it's still very considerably low. But the DG of the NCDC has said, well, we have 21 laboratories now, molecular laboratories, but there is one again that will soon be ready in Port Harcourt. So within a week or so, we're likely to have up to 22. So if we have testing reagents, we get more testing kits, we're likely to see the numbers going up.
But do you think it can get to the 2 million that Dr. Ehekweazu believes that we can get to in the next 2 months? It does seem to be rising quite slow if that is the figure that we want to get to, but I am optimistic still.
Well, that was his projection about 2 weeks ago, that within a period of 2 months, they would like to have tested up to about 2 million persons. But all of that would depend, of course, on the resources at their disposal.
Exactly.
And also, how the states cooperate with the federal government to make sure that more testing is done. That's one leg of it. You refer to the NCDC sending a presidential team, a combined team of Ministry of Health officials, disease control officials, and some other officials to Kogi and Cross River states. These are the 2 states that have not recorded or reported any confirmed case of COVID-19. Weeks after, 34 other states and the FCT have reported cases. Now, the objective of sending that team to these 2 states was for them to provide support, first to do an assessment of the testing capacity in those 2 states, and to take a look at the facilities, and then to provide technical support in terms of the testing. But they didn't get a good reception in Kogi State, which is most unfortunate. The governor, we were told after they presented the letter, from the federal government to the governor, told them that, well, Kogi State has experience in terms of, handling infectious diseases. And they identified these infectious diseases as Lassa fever and malaria. Those were the 2 that he mentioned. And that experience is now being applied to
a new disease that nobody knows anything about.
To coronavirus or COVID-19. And then he insisted that for daring to come to Kogi State, the NCDC officials should be quarantined for 14 days, or they will be subjected to a coronavirus test. And if they did not agree, they should leave the state. Now, what happened eventually was that they left. They went back to Abuja. I think that, as an example of the relationship between states and, the federal government on this issue of COVID-19, what happened in Kogi State is clearly condemnable.
Honestly.
And I do not think that the conduct of the governor of Kogi State is anything encouraging.
Exactly.
The NCDC team that went there was a team of experts, and they had gone there to provide support. But clearly, the message of the governor to them was that they were not welcome in the state.
But the question is as well then, if you're so confident about the status of your states, then why are you so afraid of the federal government coming in to clarify your so-called status of your states?
Well, that's why I say it's very shocking. It's
Honestly.
unbelievable. And we would like to see greater collaboration between the federal government and the states.
Yep.
Now, the third point you raised had to do with, security. And indeed, at the briefing yesterday, one of the points that was raised was the role of the security agencies in enforcing the lockdown, or rather the ban on interstate travel. Yeah. What has been observed is that, there have been violations. And the Nigeria Governors Forum has also had cause to protest that the security agencies are not enforcing this, because we've been seeing a lot of community transmission from one part of Nigeria to the other. However, the Presidential Task Force says it's meeting today with the Inspector General of Police and the leadership of other security agencies to see how they can work out a better template for ensuring for enforcing the ban on interstate travel.
Absolutely.
The violation of which, according to the experts, has become a major threat to the efforts of the federal government and the individual states.
Absolutely. It's a huge threat to the fight against COVID-19 in Nigeria, and it has to stop. The fact that we have essential services that are carrying people across states, the fact that we have reports of police actually going ahead and conniving with people to get them across, it's all very messy, and something has to be done, Doctor. You're absolutely right on that.
In Rivers, the governor is accusing the police of collecting bribe to violate the interstate
well, there you go. Travel. There you go. And on that note, we will take a very quick commercial break on the morning show. And when we are back, the conversations for today continue. Stay with us. Welcome back to the morning show here on Arise News. Joining us now is Rotus Odiri, our business analyst, for an update in the business world. Good morning, Rotus. How are you?
Leila. Good morning, Dr. Abasi. Yes,
morning.
very excited. Technology. I'm going to get to talk. I see I'm just fumbling my words there. When I get to talk about technology, I always get excited. Godwin Obaseki of Edo State is apparently working with a number of telcos to create a registry of 125,000 people that need help and assistance due to the impact of COVID-19 in order to create mobile wallets that will transfer money to them into their virtual wallet. So he's essentially trying to get mobile money to assist with helping people in Edo State through the telcos. It's pretty exciting because if you look at what's been happening with the conditional cash transfers around the country, some have criticized the government's efforts, saying that it's been a missed opportunity because mobile money is an effective way of getting funds, quick, secure way of getting funds to people. Essentially, a lot of people confuse mobile money with actually transferring money via your phone.
Yeah,
That's not what,
your app.
Right, it's not your app. Mobile money literally is, virtual money that is stored using your phone number or a different number as a unit of, as an account to store the funds in there. So they're going to be working with a number of telcos, and those telcos are going to assist in creating this registry through which the funds will hopefully be transferred. However, the thing is, can this be a new way for the rest of the states to actually usher in mobile money into the country? It still has to go through the central bank, right? That's still, if you're talking money in the country and how this is going to work, it still has to go through the central bank. In 2019, the central bank gave a super agent license to MTN, and that agent license is supposed to allow them to monitor how agents capture BVNs, complete fund transfers and so on for people in rural areas. But what they're really waiting for is the PSBs, the Payment Service Bank's license. That license allows companies to conduct financial services, open accounts, move money around, and essentially do what the financial services sector is doing. However, there's still, there's an agreement in principle, but the central bank hasn't exactly moved forward on that with the payments PSB licenses. So we're still waiting on that. So it's a good move what Obaseki is doing. He's using technology. He's working with the private sector. And COVID-19, this particular pandemic that we're facing, should be an opportunity for the federal government to actually say, okay, look, this is how we're going to close the gap on financial inclusion, which the central bank governor has said is part of his plans. He had an 80% financial inclusion target for 2020. I believe it's moved to like 95% for 2023. But this is the opportunity. And so what Obaseki is doing is supposed to be a roadmap. But again, it depends on getting that complete license from the CBN and having it move forward.
Yeah.
So that's what we're waiting
for. If the Edo State government succeeds with this mobile money proposal, then of course it will set a template for other states in the country. And then it will be in line with the CBN's National Financial Inclusion Strategy, part of which is to encourage mobile money by giving payment service licenses to non-financial service providers. Yes. Now, since 2018 that the CBN has been toying with this, it has managed, I think, to give the license only to MTN, which set up something called Momo agent. Momo agent means mobile money agent. And the MTN, we're told, has up to about 15,000 agents in different parts of the country, across the whole of Nigeria. But this is not popular yet. What is popular more in terms of mobile money is what is called Paga, which is in existence in Nigeria. And I see many Nigerians using it, and they seem to think that it is efficient. And Paga alone has up to about 23,000 agents. Now, the advantage of this, what the Edo State government wants to do is that, they will be able to address not just the urban poor, but also rural poor, because now in terms of penetration, there are many people in Nigeria who are using mobile phones. However, Governor Obaseki just talked about it. He didn't give enough details. Yes. One, the social register that he talks about. How soon are they going to develop that social register in Edo State? Two, there is the issue of identity. I guess, the telcos will help in that regard, because once you have a phone, they're supposed to know your identity. Right. But we also know that there are identity issues in Nigeria. Three, the telcos are supposed to collaborate with with financial institutions, with the banks. Yeah. Now, what are the details? What are the modalities for that collaboration? So there's a lot of gray areas yet. So we just hope that, what the governor has said is not just election year talk, and that it is going to walk the talk and do it. But it has worked very well, what they are proposing in East Africa, particularly in Kenya, where they have M-Pesa, and also in India.
But you know what's also very interesting to note? If you look at all the queues that you've seen outside the banks since the easing of the lockdown, what you know is that a lot of people don't have access to apps on their phones. A lot of people don't use apps, and mobile money is in very high demand. Correct. So certainly it is an option that has to be explored beyond Edo states, and we'd love to see that going through different states in the Federation.
For sure. And let's hope that this will encourage the CBN to be more aggressive in promoting mobile money.
Certainly.
Because the advantage to the banks will be, at the end of the day, that you don't need to even worry about setting up branches.
Right, exactly.
And then there will be greater financial inclusion.
Exactly.
Like you said, Kenya, and they're getting it right. Rotus, thank you for today's updates.
Thank you, Rotus.
It's time now for a quick break on the morning show. When we are back, we'll be joined by Aaron Akerejola for a daily update on COVID-19. Stay with us. Welcome back to the morning show here on Arise News. Joining us now is Aaron Akerejola for a daily global update with regards to COVID-19. Good morning, Aaron. How are you?
Yeah, good morning, Leila. Good morning, Doctor.
Good morning, Aaron.
Thank God it's Friday.
Oh, yes.
TGIF.
Yes, you can say that again. And
we all sounded so relieved.
It's been a treacherous week, I must say.
It honestly has. It really has.
Okay, let's start it off with the numbers. Looking at Africa and how things are actually shaping up. At the moment, 54,027 cases have been recorded of COVID-19 in Africa in general, with over 2,074 deaths and 18,636 recoveries. Of course, Northern and Western Africa still dominate these figures. But this morning, the Africa Director of the WHO, talking about Matshidiso Moeti, is actually firing a very, very massive warning shot to African countries, because she has said that about 83,000 to 190,000 people could actually die of COVID-19 in the first year. And she says about 29 to 44 million people could be infected. And when you look at this, of course, this research is based on prediction modeling, looking at 47 countries and about a population of 1 billion people. And she has been, and this is really, really scary, understanding how Africa has actually managed this. Although she said that at the moment, we are recording very, very low cases where you put it side by side with other countries in the world. But nevertheless, we need to be very careful. And she's making some recommendations that smaller countries, first of all, stand bigger risk of having this thing spiral out of control if the government does not put some things in place, which would actually include the need to expand capacity for primary hospitals. And more importantly, not just that alone, creating emergency care units in primary health centers. If all these are not done, then we might just have not just crisis, we might really, really have a lot to deal with in the coming year.
Well, I mean, I think the WHO Africa Director is correct. We face a crisis with the health infrastructure in many states of Africa, particularly in sub-Saharan Africa. And that is why commentators have been saying that one of the takeaways from this current experience is that African countries need to invest more in their healthcare facilities, starting from the primary healthcare level, which you refer to, up to the tertiary level. And in Nigeria, Nigerians like to say that, well, given the weakness of our health infrastructure, the rich, the elite, who usually go abroad for treatment. Now, we are all stranded here, and we are all facing the challenge of not developing our health infrastructure. Also yesterday, there was a report by the Office of National Statistics in England, which indicated that black people are 4 times more likely, more than 4 times likely to die as a result of COVID-19 than, people of other races. And the same will also go for people from Southeast Asia, people from the Eastern Mediterranean zone. The explanation for this, according to that particular report, is that 1, where you live matters, location, and then 2, socioeconomic conditions. But there are persons who will probably say that, yes, black people are likely to die more, not just in Africa, but also, in abroad, as that report indicated, because of lack of access to quality care.
And that's what it is. And we've seen so many stories coming out from the West of stories of black people that were really and truly abandoned when they went forward with their cases of COVID-19, presented to hospitals, turned back, told to go home. And at the end of the day, if you do come from a BAME community, unfortunately, you clearly are more likely. But bringing it back to Africa, what's also interesting to note, I think we brought it up earlier on this week on the show, is that only 3% of Africa is over the age of 80% as well. And this is a disease that is taking more lives of the elderly than it is of younger people. So we need more research going into Africa's unique problem, because what we are also seeing in Africa too is more mild to moderate systems. What does this suggest? Does this mean we will see it lasting for longer because it's harder to detect? Or does this, we need to find out more, and we need more research and development. Yeah,
no, they actually made, the WHO report actually makes reference to that this thing, the fact that it's almost like a silver lining in a very dark cloud, understanding the fact that the median age in Africa is
about 21 years old.
Yeah, so when you look at that, that would actually work for us on the short term, but on the long term, like you said, because several of these people do not have complications, so it will not be detected easily, and over time, these things could actually spiral out of control.
Yeah, absolutely. More research.
Thank you very much, Rotus.
Rotus again.
I said Rotus.
We have a great weekend.
All right.